Ladies and gentlemen, welcome to the Authentic Podcast with Justin Doulard. And thank you for tuning in to another episode. It's time!
Okay, we are back for another episode. We have our first doctor on the show, which I am super proud of and appreciate you for coming on. We have Mr. Dr. William Davis out of the Wisconsin area, a preventative cardiologist who is a multiple New York Times #1 bestseller. This gentleman has been featured on dozens of media platforms to include Dr. Oz, Live with Kelly, Fox TV, CBS This Morning, and like I mentioned, dozens of other newspapers and articles and TV shows. He has not been on those as of late, which we will discuss a little more, but please welcome Dr. William Davis.
Glad to be here, Justin.
Yes, sir. Thank you for coming on. I really appreciate it and really looking forward to this conversation. I wanted to just give a quick start off on why I read your book, why I reached out, and all kinds of things. So, wife and I started a fitness challenge called 75 Hard, pretty popular with a guy who owns a supplement company. And, pretty basic stuff: exercise, a gallon of water, following a diet, reading. Reading is a component of it. You got to read 10 pages a day. And so I was like, okay, well, while I'm on the fitness journey, I was like, I'll read, part of a fitness book is one of the things. And many, many years ago, I was unfortunately eating at an Applebee's. So eating at Applebee's, and I thought, I like to do different things and kind of challenge myself and do fun stuff. So my wife and I decided for 30 days we were going to go vegetarian, which doesn't sound hard, but I had never done that. So I was like, we'll try it just to see. Health, and then just to see if I could do it mentally. So I'm at Applebee's eating, and there's not a lot of meat-free things at Applebee's. It was literally a salad or this macaroni that had bacon in it. So I said to the waiter, hey, I'll take the macaroni, but take the bacon out. And he was like, why do you don't want bacon? I was like, well, I love bacon, but trying to go vegetarian for 30 days. And he was like, why would you do that? That's not that healthy. Meat's not that bad. He's like, if you're really trying to lose weight, he's like, you need to cut out the breads and the carbs. And I was like, I know. It's just kind of a fun thing. He said, well, you need to read this book called Wheat Belly. He's like, it's crazy. Talks about how bad wheat is for you and all this. And I said, yeah, okay, I'll check it out. I was like, I believe you. And for some reason, I never forgot the name of that book, and I'd seen it pop up on social media and stuff. And so when I started the 75 Hard, I was like, I'm going to read some other books. The first one I read was Tom Brady's book, TB12, who is, takes really good care of his body. Very similar things to the way you preach in Wheat Belly. But then I bought Wheat Belly and I read it. And then I finished it last week, and I was like, hey, I'm podcasting. I have all these people. I was like, I'm going to reach out to Dr. Davis. And I reach out to a lot of people, and some people don't ever reply, and some people do. And here we are. The book was phenomenal. I loved it.
Thank you.
It's
true.
well, I knew that, breads and tortillas and rice and in abundance were bad for you, but I did not know the things that you told us in this book were so severe and so bad. So, we can dive right into it. Kind of talk about your history as a cardiologist, and then what led you to get on this path to tell people how bad wheat is for us.
Well, I stumbled my way here, Justin. It wasn't like I had a scientific revelation one day. A lot of it started with when I was in practice as interventional cardiologist, putting in stents and doing angioplasty, aborting heart attacks, all that kind of stuff. And my mom died of sudden cardiac death a few months after she underwent a successful coronary angioplasty in New Jersey, where I grew up. I was living in, I just moved to Milwaukee, Wisconsin. They brought me in, ironically, to introduce a lot of new technologies, because I was doing all the new fancy stuff back in the 90s. So they brought me here, but then my mom dies of the disease I take care of, or I thought I was taking care of. So one of the things I did was I changed course, and I realized that trying to deal with coronary disease, heart attacks, sudden cardiac death in a cath lab was just plain stupid, because you get people who are in crisis, or you tell people they need procedures when they don't. That is shockingly common, Justin. It's shamefully common. But anyway, So the only device then and now to detect hidden heart disease is a CT heart scan that generates a coronary artery calcium score. Very simple. Because the calcium occupies 20% of total atherosclerotic plaque volume in your coronary arteries. So we scanned people left and right. By the way, the hospitals were not interested because there was not enough money in it. They told me that. So we got independent funding. We opened a heart scan device, and it was the first scanner in Wisconsin, one of the first in the Midwest, one of the first in the country. We're scanning people, just everyday people like you and me, who go to work, go to school, go for walks, swim, bike, no symptoms, just everyday people. They come in, and holy crap, there's heart disease everywhere. But what do you do about it? So if somebody has a normal score is 0, what if you have this business guy with a score of 700? Or a mom score of 380. Those are very bad scores. Well, the conventional response is put them on aspirin, a high dose of a cholesterol statin drug, a low-fat diet, low-saturated fat diet, exercise, and maybe a beta blocker, blood pressure medicine. Well, we help publish these data. If you do nothing for a heart scan score, it goes up 25% per year. It's terrible. If it were money, it'd be growing like crazy, but it's your plaque that ruptures and causes heart attack. So it terrifies the heck out of people because a score of 300 is 307. What's 25% of that? 375, something like that. And then another year later, 25% higher. And every time you get closer to dying, heart attack, developing symptoms, that takes you to the cath lab. So 25% for you if you do nothing. What if we did all the things? What my colleagues to this day still call optimal medical therapy, aspirin, low-fat diet. How fast does that score go up? 25% per year. It's shocking how ineffective those therapies are. So my colleagues, some of the experts actually said this. Well, don't repeat the scan. Let them have their heart attacks or other events, and then we'll take care of it, which is that is a really bad thing to say. But that was consensus opinion. So here I am about 20-some years ago thinking, what the hell do I do? All these people freaking out on me because they have these high scores that are going up, going up, going up, going up. And so I stumbled about looking for strategies, and I found them. One of them, for instance, was vitamin D. This is years ago, before people were talking about vitamin D. When we put people on vitamin D, it was the first time we saw scores drop dramatically, 700 dropping to 350 or something like that. But one of the reasons that people develop coronary disease is not cholesterol. That's big pharma's Kool-Aid because they make a lot of money reducing cholesterol. Cholesterol has nothing to do with heart disease. It's just a marker. It was intended to be a marker for the particles in the bloodstream that cause heart disease. But we can measure the particles now. We don't have to rely on this crude, outdated Model T of testing called cholesterol testing. Yet the prevailing opinion among my colleagues, everybody needs to take statins, put it in the water, lower your saturated fat, even though the evidence is clear. Those things do not work. Whether you're looking at it from a heart attack standpoint or death or coronary calcium scoring, those things simply do not work. But there's a test called lipoprotein analysis, like a method called NMR, and you see the particles in the blood, and you'll see right away that the dominant abnormality among people with coronary risk and coronary disease is an excess of small LDL particles. They're very aggressive and they cause heart disease. It's very unusual to not have oodles of small LDL particles when you have heart disease. And so I asked myself, and this is not my data, there's ample data from Ron Krause's laboratory at UC Berkeley, from Hopkins, other places. The only foods that cause small LDL particles, wheat, grains, and sugar. So I asked my patients, hey, your heart scan score is 685. Let's try this. You got tons of small LDL particles, maybe 2,400 nanomoles per liter, particle count per volume. And they said, okay, it's kind of weird. I said, don't worry about fat. Don't worry about calories. That's all garbage. We're going to concentrate on the small. They do it. Small LDL drops to 0 or near it. It's not 30% better. It's 0 or close to 0. But they'd come back and say, you didn't tell me I'd lose 47 pounds. You didn't tell me that I'd have to stop all my diabetes medication because I don't have diabetes anymore. You didn't tell me that I had to stop my 3 blood pressure medicines because I was getting lightheaded on my blood pressure medicine. You didn't tell me my rosacea rash would go away. You didn't tell me my migraine headaches would go away. So it became clear after I did this with thousands and thousands of people, I had stumbled for the sake of coronary disease and CT heart scans I had stumbled onto something. I thought I was the dumb shit because every dietitian, every doctor, every agency says you must cut your fat, eat more healthy whole grains, right? A diet centered. Remember the food pyramid? Biggest part was grains. And the food plate now, still grains, big part. They'd say, eat more grains, every meal, right? Every snack, grains. Well, what they're doing is they're causing type 2 diabetes, obesity, coronary disease, and a multitude of other diseases. So, but what I found when we did the exact opposite of dietary guidelines, we saw, I won't say miracles, but we saw spectacular things happen to people's health.
I took a couple pictures for you. You probably won't be able to see them. I'll show you, but I do wear a Fitbit because it tracks like my weight, and then I just enjoy it. I had a Whoop strap to help track my sleep and whatnot, but it has little suggestions at the top of it every other day. Some of it nutrition, some of it's like drink water, all that shit, But like I said, I'll show you these, but you probably can't see them, so I'll read it. But a little notification at the top. I took 2. So eating 3 servings a day of whole grain, and I didn't even pay attention to this until I read the book. So I knew I was going to try and do this. Eating 3 servings a day of whole grains is linked to lower body weight. Options include brown rice, oats, barley, rye, and buckwheat. That was one of them. And then one of the other ones, let me scroll down here real quick and find it, is, and I was watching some of your YouTubes, couple nights ago when I knew you were coming on, and then my recommended YouTube rolled into another gentleman who was a cardiologist and talked about how somewhere along the line the breakfast companies in the industry kind of pitch that if you eat breakfast you're going to be healthier and lose more weight, and that kind of pushes your most important meal of the day. And then this says research suggests breakfast eaters are more likely to maintain weight loss. If you are short on time, try make ahead meals like oats or healthy muffins. So you can. But yeah, just a little notification at the top, and that was Monday. So
they drank the Kool-Aid. So they drank the falsehood that whole grains control weight, reduce colon cancer, heart disease, and type 2 diabetes. What they didn't realize, for instance, a lot of that data comes from the epidemiologic studies out of Harvard, the Harvard School of Public Health, the Nurses' Health Study, and the Physicians' Health Study. So these are studies like this. I say, Justin, what'd you eat Monday? You say, oh, gee, I think I ate 2 eggs and maybe I had some bacon. I don't remember. And then we watch what happens to you over 10 years. And we say, okay, fat causes heart disease. That's how they construct these studies. So they did in the Nurses' Health Study, 47,000 nurses. And they showed that women who ate more whole grains gained less weight. So the women who ate whole grains gained 11 pounds. The women who ate white bread products gained 12 pounds. Now, a logical conclusion would be grains are associated with weight gain, but it's slightly less bad with whole grains. But the interpretation was whole grains help control weight, which of course is an absurd conclusion. You'll see, by the way, you'll see this, Justin, over and over again in nutrition studies. It's garbage science. You cannot say, Justin, what'd you eat Monday, and then predict if you're going to have colon cancer, heart disease 5 to 10 years later. It's garbage science, but it's the basis for the dietary guidelines.
So we talk a lot about things that we base a lot of it off of America. What are Americans doing? You talked a lot about things change with food culture in the 70s and the 80s in America. Like I think a lot of Americans, I typically only keep up with things that are going on in America. That's just me. I'm not a big news guy. So that question leads me to this. Is this like an American, only an American issue, or does this happen in other places across the world that are similar to us, or is this mainly an American problem? Do you know that?
It's a human issue. It's a little worse here because of these stupid guidelines and because the push to change wheat specifically, as well as corn, by the way. So lots of genetic alterations were introduced. So this all happened in the 50s and 60s. There was a research center in Mexico, and it was a well-intended research effort. It was meant to try to make Mexico self-sufficient in food. And so American scientists were working there, and one of the things they did was they introduced huge thousands of changes into the genetics of wheat, as well as corn and soy. But one of the things they did with wheat was they took traditional wheat, 4.5, 5 feet tall, and they turned it into an 18-inch tall, short, very thick stalk, really big seeds, really long seed head. So it's physically very different. It's also biochemically extremely different. And one of the effects is appetite stimulation. So they changed the protein called gliadin. People say gluten, but it's really gliadin. They changed the gliadin protein in wheat and made it a more potent appetite stimulant. Farmers, as well as agricultural scientists, also selected strains of wheat for better pest resistance. You know, if you're a farmer, you got to worry about mold and insects in your fields. So they selected wheat strains that had greater content of something called wheat germ agglutinin and phytates. Now, it's quite effective. It keeps the bugs away, but they're also very potent human toxins. Wheat germ agglutinin is a very potent bowel toxin. Phytates bind minerals very strongly: calcium, zinc, iron, magnesium, manganese, and others, and you poop them out. So in other words, that's why we have so many deficiencies in minerals, because the phytates are very effective at binding minerals, and you pass them out in the toilet. And so these things, phytates and wheat germ agglutinin, were enriched by farmers for their own agricultural purposes, not aware that they were increasing the toxicity of modern wheat. And modern wheat has been enriched in something called amylopectin A. Amylopectin A is the carbohydrate of wheat. So many things in wheat are indigestible to humans. That's why the proteins are very toxic to humans. We can't break them down. We don't have the enzymes to fully break them down. But there's an exception to that. The carbohydrate is very digestible. It's extremely digestible. It's among the most digestible carbohydrates of any food. That's why the amylopectin A in wheat and bread products raises blood sugar higher than table sugar. What cracks me up, if anybody takes a look at any table of glycemic index, that is how high blood sugars go after you eat some food, you'll see the glycemic index of wheat, whole wheat, is higher than table sugar.
Yeah, there it is right there on the back. Did you know that eating 2 slices of whole wheat bread can increase blood sugar more than 2 tablespoons of pure sugar? Crazy. I saw that, and I actually put a poll on my Instagram that I was like, you know, do you believe that, or does that sound like crazy off the wall? And it was about 50-50, because to me it sounded crazy. Obviously, I'm sure it's not, but it you know, I'm sure it sounds crazy to a lot of other people too. So I read the book. I'm not a huge science guy. I'm not afraid to admit that some of this stuff goes way over my head. So I was going to ask if you can do 2 things if you can. Can you dumb it down to like someone who doesn't have a doctorate degree on how these people genetically modified wheat to what it is? And then two-part, talk more about how gluten-free isn't as sexy as it sounds.
Mm-hmm. Yeah. So all these changes introduced into wheat precede the age of gene splicing, genetic modification, GMOs. So, because I tell you that because agribusiness criticize. They say, "Oh, David says wheat has been genetically modified." It hasn't been. They're playing games with you. What they're saying is there's been no gene splicing methods used, so there's no genetic modification. The truth of it is they use methods that were crude and in often, many cases, worse than genetic modification, such as something called chemical mutagenesis. This is taking a toxic chemical like sodium azide. It's very toxic. In fact, there have been several episodes of accidental consumption, and the poison control people tell you if you accidentally consume even a little bit sodium azide and the person dies, they die almost immediately. Don't give the person CPR because you're going to die also. And if they vomit, don't throw the vomit in the sink because it could explode. And that has actually happened. No kidding.
Wow. Okay.
So sodium azide was used to induce mutations. Well, you can't say, I want to mutate chromosome 25 on this. You can't do that. So what they did was over and over and over again, introduced dozens of mutations until they got the mutations they wanted. In one case, for instance, resistance to an herbicide. So Oregon State, they did studies to make wheat resistant to the herbicide imizamox, and it worked. So that's one example of the extreme methods used. There's other methods also. A lot of the methods were just crossbreeding. If you have a shorter strain and a tall strain, you breed them together. and you get an in-between strain or something like that. There was thousands of experiments like that. But this all preceded the age of genetic modification. But it doesn't mean that it's benign. And of course, with every change, there's no testing in humans. If a farmer chooses to increase the phytate content of wheat germ gluten, they don't test it in humans. They just assume if it makes a good roll or bagel, it must be okay. So that's how they introduce all these changes. And it is very physically different. When I first wrote the book, I wanted to go see wheat fields. I'm thinking, where are these damn wheat fields? I realized you had to get out of the car, walk, because it's way down. It looks like a field of grass.
Yeah.
It does not look like a field of wheat anymore. And then your second question was?
So you talk a lot about gluten-free, and there's this kick of people like, oh, I have gluten intolerance, and I can't handle gluten, so I go gluten-free. And then your book and all your blogs and stuff, you're saying it's damn near just as bad as the regular stuff, and it's really not as gluten-free as it portrays.
There's a lot of problems with the gluten-free stuff, processed foods, so much so that it ruins a lot of people's health. It's not uncommon, for instance, to go gluten-free and gain 30 pounds in the first year. The reason for that, so if most processed foods, if it's an avocado and it's gluten, that's okay. If it's an egg, it's gluten-free, it's okay. You'll even see gluten-free water. That's stupid, but yeah. So those kinds of things that now if you don't have gluten, gliadin, wheat germ gluten, those are okay. The problem is the food manufacturers who make gluten-free pasta, baking mixes, bagels and bread, all that stuff, choose cornstarch, tapioca starch, rice flour, or potato starch. So we talked about how wheat raises blood sugar higher than most other foods. There's only a short list of other foods that raise blood sugar higher. What are those foods? Cornstarch, rice flour, tapioca starch, and potato flour. Jason, it's almost like a cruel joke. So they're using something that is far worse than sugar, that raises blood sugar sky high. Also, cornstarch is a starch, but it's contaminated by the zein protein of corn, which looks a lot like the gliadin protein of wheat, the gluten protein. So a lot of people with celiac disease, for instance, will adversely react to cornstarch and gluten-free foods. Yet the gastroenterologist, who doesn't really understand, doesn't give a damn, by the way, about celiac disease, because they care about colonoscopies and endoscopies and revenue from procedures. And so my son's wife didn't get diagnosed for 11 years in her celiac disease. And then when she was finally diagnosed, she was given a handout. Follow this gluten-free diet. Eat gluten-free food, cut your fat. This is the state of affairs and dietary advice. It's so bad. But so what we do is we can have pizza, we can have rolls, we can have pancakes, we can have breads and sandwiches, but we're going to make the breads ourselves using benign ingredients. It's not that tough. Using almond flour, ground golden flaxseed, coconut flour, other benign flours that don't screw with your blood sugar, don't make you gain a ton of weight, don't cause heart disease. So no one talks about this. Gluten-free foods are extravagant causes of heart disease and type 2 diabetes and dementia. It's amazing, Justin. This goes on, and that's about a $7-8 billion a year industry growing because people were persuaded that somehow gluten-free is better. Gluten-free is fine. Just don't eat the processed gluten-free garbage foods.
If a question I had was for somebody, if you were wanting to eat like some spaghetti or pasta, what would be a good substitute for that? Do you have to make your own pasta or spaghetti noodles, or do you cut it out? You don't do it.
There's really no perfect replacement for pasta. That's one of the biggest challenges. That isn't very high carb and screws with your blood sugar and weight gain. So we do things like spiral cut zucchini, other spiral cut vegetables. There's something called shirataki noodles made from a root. There's an increasing choice. Also, there's spiral cut kohlrabi is a very good one. You can spiral cut them yourself. You can buy inexpensive spiral cutters. And now some grocers are actually selling some of these pre-spiral cut vegetables, because it is a little bit of work.
Sure.
But you can have something like that, and it's actually pretty tasty.
Yeah, my wife and I actually have done spaghetti squash a dozen times.
Spaghetti squash, yes.
Yeah, we don't need a lot of spaghetti either way, but we've definitely used that before when we're trying to be healthier. and cut down on the wheat per se. Another thing I was going to talk about is, for you talked about cooking. If you're going to eat bread, cook your own bread and those sorts of deals. For you, and when you got on this journey, do you cut out wheat 100%, or do you cook your own breads when you want breads, or do you, have you fallen off the wagon at all? I mean, obviously, I'm sure you're as close to wheat-free as you can get. Like, for you, when's the last time you had a traditional piece of wheat that you see in the supermarket, or a regular slice of bread, or
12 years ago, long time before I wrote the book. Okay. Because one of the things that happens, Justin, for the majority, the longer you're wheat and grain free, and I say grains because wheat and grains are very genetically promiscuous. They share a lot of traits. That's why, rye got its start as a weed in wheat fields, and it acquired a lot of the genes from wheat. So the gliadin protein is identical in rye. The wheat germ agglutinin is identical. So even though it's called rye, it tastes, it smells different, it's essentially wheat. Likewise, barley, corn also, and to some degree, rice. So with a broad stroke, we eliminate all grains because there's too much overlap, and there's no grain that is entirely benign or good for you. They're all bad for you to one degree or another. But one thing, there's an odd phenomenon. When you go wheat and grain free, first of all, about half the people will go through a period, 5 days or so, of fatigue, headache, nausea, and depression. It's an opioid withdrawal syndrome. So the gliadin protein of wheat is not fully digestible by humans. We don't have the enzymes to break it down to single amino acids. So it's broken down to small fragments or polypeptides. Well, these polypeptides act as opioids on the human brain. And that's why it causes food addictions and increased appetite. So when you stop eating it, about half the people go through a withdrawal syndrome. Everybody survived. No one's died. It can be unpleasant, though. But then you're wheat and grain free. You're feeling great. You're eating eggs. You're eating avocados. You're using tons of olive oil and butter. But then you're exposed, either on purpose or inadvertently, like at a restaurant. And you've got diarrhea, skin rashes, asthma, anything that went away originally, like rosacea or seborrhea, or high blood sugars, or insatiable appetite and food obsessions, or migraine headache. Anything that went away can come back. And it depends. So if you had a skin rash, you'll have a skin rash for a few weeks. If you had rheumatoid arthritis and it was relieved with this, it can come back for months. So the re-exposure reactions are very unpleasant. And the longer you've been wheat and grain free, the more unpleasant they become for some unclear reason. There must be some form of tolerance, partial tolerance for people who've been consuming wheat and grains. Nobody has full tolerance, by the way.
Do you think we will ever progress further? Because it seems like, I don't know, however many years, the past 2 years, 3 years, 5, 10, there's been healthy kicks of people, like people, at least maybe they didn't know, but they were trying to do the right thing by going gluten-free, or maybe going less meat, or, going vegetarian. You and I talked a little bit before about how the media is kind of against these things because it's their big buyer, and they sell commercials, and they sell, healthcare to do these sorts of things. Do you ever think that we will go forward, or do you think we're just continuing to go the wrong way with our diets and our foods and the knowledge we have with this type of stuff?
I don't think this will ever become a broad and global process because it's impossible. So this planet sustains 7 billion people, many of whom are hungry. And if we said no grains, we'd have millions starving. So it's unsustainable. So it's because humans made a crucial mistake 12,000 years ago when they first consumed wild and then cultivated wheat and grains, and it became food. So if we all turned to eating fish and meat and eggs and butter and green vegetables and legumes and that sort of thing, there wouldn't be enough. So this is really, I hate to say this is really for those of us who can afford to do this, and mostly in modern countries. But the truth of it is, health is miraculously transformed when you do this. And you also, go to Walmart, see what Americans look like now. It is shameful. Yet, or go to Ethiopia, go to the Sudan, go, rural Asia, and they can't do this. They can't afford it. So it's really, I hate to say this, but it's really something we can do in the modern world, the modern Western world.
Do you think that is part in the fact that we became so reliant and dependent upon it? Like you said, whenever I can't remember the name or the time frame, but about the gentleman who won the Nobel Peace Prize for being so creative with the modification of wheat, it kind of changed and saved lives at the time. And now we've created this dependency and we just can't go back from it because the population has grown so much and we've become so dependent on it. Much like we're dependent in America for the most part, at least on supermarkets and fine-tuned logistics. People are so used to, going to get their groceries 24 hours a day. You can go to Walmart anytime at night and go get, ready to eat meals. And if that shut down for a week, 2 weeks, anything, it could be disastrous for most of the country. So,
yeah, we traded survival and calories for long-term health. In other words, when humans first turned to wild wheat, they were starving. They fell short of food. There was climate change going. This is 12,000 years ago, and you got to give them credit, because if you look at a wild wheat plant, it looks kind of like traditional wheat that we would recognize. But how do you take those seeds and isolate them? It's not food. You let it dry, you pulverize it back then with a stone, and then you heat it in stoneware over a fire. You make porridge. And then many thousands of years later, the Egyptians figured out how to make beer with yeast and fermentation, and that's how they learned how to make leavened bread. So that came thousands of years later. What they didn't recognize was, yes, it kept you alive because you had calories at times of desperation, but then you had rheumatoid arthritis 10 years later, or a doubling of osteoarthritis, or all the other health problems we now have, now amplified because of the changes introduced into wheat and silly dietary advice to make it a dominant factor in your diet.
I noticed in the book that you had said that diabetes were pretty much non-existent in the hunter-gatherer times, and maybe a little forward, a little backward on that. How do we know that?
Diabetes is a little tougher to prove. It's not, because you have to go back to essentially autopsies of recovered bodies. But diabetes is a little tough. But there is some evidence that diabetes was an uncommon thing, because people, if you have diabetes, you don't just have high blood sugar. You have coronary disease, stroke, amputations, peripheral neuropathy, gastroparesis, where your stomach doesn't move, it stops moving. In other words, there are real consequences, and these things were simply not happening, or they were very uncommon. Very uncommon. If you were living in 19th century England, which they did not have a good diet, but diabetes was uncommon. It did happen, but it was uncommon. It's like coronary disease. Coronary disease was uncommon. Coronary disease is pretty clear: chest pain, sudden cardiac death, heart attack, those kinds of things. So we know with confidence. Now, in indigenous peoples, whether it's North America, South America, Hadza in Tanzania, the Yanomami in the Brazilian rainforest, the people in Malawi in Eastern Africa, these people have been studied. These are living people. And some of these studies go back a few decades because these populations are shrinking. But these are people who've never been exposed to antibiotics, don't have a cell phone, never consumed wheat or grain, most of them, wheat or grains, because they don't farm grains. They kill things, dig in the dirt, gather fruit, that kind of stuff. So these people have no coronary disease, no ulcerative colitis, no hemorrhoids, no constipation, virtually no schizophrenia, very rare. They have other problems, right? No diabetes, no hypertension. They have dengue fever and malaria and nematode infestations that works. So they have infection and injury, but they have none, or close to none, of what anthropologists call the diseases of civilization. Well, I think there's an important lesson in that, right? That what can we learn from those indigenous populations? And by the way, every indigenous population that started to consume grains, so 12,000 years ago in the Middle East, about 8,000 years ago in sub-Saharan Africa with millet, And then in Central America with teosinte and corn and maize, the predecessor of corn, and also in southern U.S., that's when they started eating corn. This is about 4,000 to 8,000 years ago. In each of those instances where humans went from hunting and gathering to gathering and cultivating grains, the record is quite clear. There was an explosion in tooth decay. So indigenous populations have only 1% to 3% of all teeth recovered showing decay or abscess or misalignment. And yet they had no toothbrushes, no fluoridated toothpaste, no dental floss, no orthodontists, no dentists, but almost no tooth decay. When any of those populations around the world started consuming wheat or grains in some form, like corn or millet, there was an explosion in tooth decay. You can see it. You can see skulls filled that teeth are missing, abscess formation, misalignment. So 16 to 49% of people lost their teeth or had rotten teeth or abscessed teeth. There was also a doubling of arthritis, especially in the knee, and there were multiple deficiencies that showed up. You can see this in the bony record. And so even consuming traditional wheat. So modern wheat is just a worse version of traditional wheat, but people had problems even with traditional forms of wheat.
So it's just gotten worse. What year did you write Wheat Belly, the original one?
That was 2011.
2011. Okay. In there, I'm paraphrasing. I think this was the quote or the stat, but it said 16 to 18% of healthcare costs will be derived directly from health issues from excess weight. So that was a decade ago. Do you think that number has gone up? And
it definitely has gone up. And so, obesity and overweight are not benign conditions. People think, oh, I got to lose it. No, you're going to die younger, anywhere from 2 to 10 years before other people do. And, your last years are not fun and games.
You're saying if you're obese?
Yeah. It's open sores in your legs because there's poor circulation. It's acceleration of dementia, Alzheimer's dementia. It's loss of vision from diabetic retinopathy. It's dialysis because your kidneys are failing. In other words, there's a whole ton of problems when this happens. And it has been caused to a great degree by the collusion of dietary guidelines that are ridiculous and the exploitative practices of big food, and big pharma is not helping either because all they have are Band-Aids and crutches. They don't show. So if you're diagnosed with type 2 diabetes, the appropriate answer should be, well, do you want to learn how to not be diabetic? It's easy. Or should I just hand you a prescription for metformin and Byetta and Farxiga and Toujeo, all those ridiculous names that big pharma likes to give their drugs, and many thousands of dollars every year, 8 years shaved off your life. And it's astounding that that most will accept this as a status quo, when the truth of it is so damn easy to not be diabetic.
When you talk about obesity and how a lot of Americans are obese, I think for the most part, you can obviously gauge if you're obese or not just by looking in the mirror or how you feel or the size of your clothes. But I wanted to talk about the BMI metric. One, is that what you still would typically base off of being obese, is the BMI metric? Or is that something that, because I've heard a lot of people say that they think the BMI metric is outdated and then that was used for, hundreds of years ago or dozens of years ago, and it's kind of outdated. Are people just saying that because we're kind of making an excuse and crutch for how big we are now? Or is the BMI still a pretty good measure of your obesity?
It's not a good measure for an individual. It's a good measure for a population.
Okay.
That is, so it allows you to quantify weight in a way that you can analyze. But if I said I have a BMI of 27, well, maybe I lift weights and I have more muscle or higher bone density. So there's a lot of factors that enter into it. So you don't want to take BMI. Now, your BMI is way off the chart, like 36. You are obese. But if it's like 27, like a borderline, 25 and lower is presumed normal, 30 and higher is overweight, 35, 36, 30 and over is obese, 25 to 30 overweight, and then way into the 30s, you get into the super obese in 40s. So those are helpful for a population. They're not that helpful in the borderline areas when applied to an individual. But all this debate is for purposes of constructing studies and data. For an individual, you don't really need any of that stuff. Look at your waist size. Do you have love handles? There are numerous markers that people overlook also, like high blood sugar, of course. So what we do is we aim for ideal or optimal values, which would be a blood sugar of 90 milligrams per deciliter or less, fasting insulin of 4 microunits or less, triglycerides of 60 milligrams per deciliter or less. And these are wildly different than guidelines. So for instance, with triglycerides, they'll tell you, 150 and less is okay. Not telling you that you have flagrant risk for coronary disease, heart disease, and fatty liver at a triglyceride level of, say, 135. So we aim to get it to 60 or less, and it's very easy. When I started this journey myself, I was in practice, but didn't know anything about health and nutrition because all I did was cardiology, and they know nothing about health. They know about stupid things like cutting fat, cutting saturated fat, and taking statin drugs and putting in stents, but they know nothing about health. Well, I had triglycerides. I went low-fat, vegetarian, and then I got tested. My triglycerides went to 390. My HDL cholesterol dropped to 27, which is a high-risk level. I had a ton of small LDL particles that cause heart disease. I became a type 2 diabetic, and I had high blood pressure. And I thought, I'm a low-fat vegetarian. All I eat is whole grains, fruit, and vegetables. So I called Dr. Dean Ornish. He's the guy who wrote the book, Reverse Heart Disease, back in the 80s and 90s. He was very famous for saying that go vegetarian and low-fat and you reverse heart disease. By the way, he never reversed heart disease. That's a fiction. He misinterpreted his data.
But you were eating wheat as well.
I was eating wheat back then. Yeah, this is about 30 years ago. It's just a long time. Well, I stopped doing that diet. And of course, now I have perfect values, like an HDL not of 27, but 94, last I checked. Triglycerides not 390, but 47. Normal blood sugars, 90 or less, often in the 80s. Hemoglobin A1C in the 4% range, 4.8% range. In other words, and so I went from type 2 diet. I'm not telling everybody this because my personal experience. I've done this thousands of times. And by the way, this is borne out in clinical studies also. It's not like I made this stuff up. The problem is most practicing mainstream doctors. There are doctors like functional medicine doctors, naturopaths, chiropractors who do care about nutrition, getting things right. But the mainstream doctor who's got his eye on your wallet will tell you things to generate revenues, not to generate health. So like that heart scan I told you about early, the coronary calcium score. The reason why a lot of hospitals and clinics are offering it now is because what they say is, we hope Justin has a really high score. That way we can scare the hell out of him. And we're going to schedule a stress nuclear study for $15,000 and a CT angiogram for another $5,000 to $10,000. And we'll scare the hell. Even if he doesn't need it, we're going to say, Justin, you're a walking time bomb. We can't be responsible for your safety. So we better do the real test, the heart catheterization. Now we're talking $60,000, $80,000, put a few stents in. $90,000, bypass surgery, $150,000 to $200,000. It's all about money. So that they tell you stupid stuff like take aspirin, beta blocker, statin drug, right? Cut your fat, which does nothing. Actually, it's harmful to do that. And then call me when you have chest pain. We can schedule your heart catheterization, your 3 stents or bypass surgery. That's how the world of cardiology works. It's disgusting. I'm ashamed that I did that for many years. I don't do that anymore, of course. And the truth of it is, it's very easy for the majority of people to stop coronary disease or even regress it. I published some of those data. We need to publish a lot more. But, sadly, my colleagues are not that interested. They practice something called willful ignorance. They'll pay attention to the things they know lead to a pot of gold. They won't pay much attention to the things they know might work, but don't pay. And so nutrition, talk to the dietitian. So there's a lot of bad stuff going on in healthcare, and no one hears. You do hear about some of it, but a lot of you don't. And of course, you'll never hear this on CBS, NBC, ABC, major print media, because it's not in the interest of big pharma.
Well, now you talked about on your podcast, which is called Defiant Health. You've been doing it for a couple months now. So yeah. Everybody go make sure and check that out. I've listened to 2 or 3 episodes, and you talked about, so you used to be on major media platforms, like I discussed in the intro, and you've done those, but you said in the podcast, and you told me, as of recent, that you're, for the most part, abolished, not just you, but most people speaking like you. Talk to me about whenever that started happening, because, you were on at some point, right? So what happened? What flipped the switch there?
So I was accustomed to being on national TV all the time. CBS News, Dr. Oz, all those kind of shows, very frequently. Then I wrote a book called Undoctored: Why Healthcare Has Failed You and How You Become Smarter Than Your Doctor.
Ooh, that's a no-no, I guess.
And all doors slammed shut. But I learned later on, so that was about 2015, 2016. But I learned later on, it wasn't just me. It was all book authors who had anything to say with a message potentially antagonistic to one of the biggest advertisers on media, which is Big Pharma. So turn on morning news, for instance. You'll see every third commercial now is some ridiculous drug. Or look at a magazine. You'll see it's loaded with ads for drugs. So it is a $6 billion a year. And these people are not nice people. These are very ruthless people who, they buy people. So I've known drug reps and medical device reps at 27 years old making $350,000 a year. And these are not exceptional people. These are just average people. Where else could they make that kind of money at that age? No place. So if you're making $350,000 a year because you're selling devices to the orthopedic surgeons and you lose that job and you have to take a mid-level manager job, maybe your salary is, $80,000, $110,000, something like it. It's not $350,000. So people are locked in. That's how the pharmaceutical industry works. It's loaded with money. Even though I've known a lot of people in the pharmaceutical industry, I can tell you, it's rare for somebody in that industry to like what they do. It's like, I hate it. I hate the company. I hate the people I work with. I hate the mission, but they sure do pay damn well. So they have corrupted the whole notion that media is in the business of delivering news and honesty and exposés. So you won't see any more authors on health books or nutrition. You won't see exposés of the deep systemic problems in healthcare. People think, American healthcare is great. No, it's not. It ranks dead last in the Western world in terms of cost, quality, and other measures. And so this notion that, so we pay $3 trillion a year, $10,000 per person, including down to babies, and it's going up every year. Yet we get very poor care because the intention never was help Justin and his family be healthy. The intention was, how can we squeeze him for more money? And that sounds terribly harsh, and there's exceptions, of course. There are doctors and people in healthcare who really try to do a good job. But the whole mindset is wrong, and the majority of my colleagues are, like in Milwaukee, most doctors are employees. And the hospital says to the doctor, the more revenue you generate for our healthcare system, the bigger your end of quarter bonus. So he generates more MRIs, tilt studies, heart catheterizations, brain scans, blah, blah, blah. And at the end of the quarter, $50,000 bonus. I mean, a substantial bonus, so they're incentivized. It's about money.
I know there's a lot of hot topic, what is not a hot topic these days, right? I mean, literally everything. People are on the Olympics right now and all kinds of stuff. But one of the big ones is healthcare costs and the way it's ran in America. And I know some people are, they like that it's privatized and you pay for what you get and you need health insurance and you have to pay for it. And then there's a lot of people on the flip side, naturally, that say there are countries that succeed in providing free healthcare or very low cost healthcare. Do you have any input on either of those, or do you think they're maybe meet somewhere in the middle, or are you more one-sided than the other?
I'm not an expert in the other healthcare systems, but I think that you can find better systems in the UK, in Belgium, in France, that spend about half what we do, sometimes less, because they're better They're not perfect, but they're better at not putting the profit motive first. That's the big problem in the U.S. It's all profit driven. It's all about, and it's shocking how blatant it is. There's a drug called Skyrizi, stupid name.
Skyrizi.
Or Skyrizi.
Okay.
You don't have to make this shit up, right? So called Skyrizi. It's advertised on TV all the time. It's for psoriasis, a rash, which, by the way, you can get rid of in the majority just using natural methods. Very, very easy. But anyway, you take this drug, you're handed a prescription, you take it to the pharmacist, you get one vial. You get one vial for an injection, Jason. $56,000 every 3 months for a rash. And you know, 2,000 would be outrageous. Or how about when they first came out with Harvoni and Sovaldi? Those are the drugs for hepatitis C. If your doctor said, oh, Jason had hepatitis C, you have some liver markers that are off, here's a prescription for Harvoni. You take it to the pharmacist. He hands you a vial with 120 capsules for 3 months, $84,000. Cost to manufacture, $137. Now, they have to recover R&D and marketing costs, etc. But wait a minute, $137 to $84,000 doesn't make any sense. But that's the exploitative practice and philosophy of Big Pharma, the modern version of Big Pharma. The truth of it is, you can accomplish astounding things in health. That's why I wrote the Undoctored book. That's why I do all these crazy things. So the truth of it is, for the vast, I mean, if you break your hip, you need the hospital. If you get, pneumonia or respiratory distress from COVID-19, you need the damn hospital. But for the modern chronic diseases of civilization, hypertension, psoriasis, rosacea, coronary disease, type 2 diabetes, prediabetes, acid reflux, fatty liver, on and on. Those are easy to get rid of. It's stupid easy to get rid of. But the last person you want to ask on how to do it is your doctor. Justin, in what other industry? Imagine your car won't start, and you ask the mechanic, hey, Jack, what's wrong? Car won't start. He says, let's just put a new engine in for $4,000. And he knows nothing about changing the oil or spark plugs or the condenser. In other words, in what other industry can the presumed expert not be an expert, in fact, knows almost nothing except about the things that serve his revenue, serve his interests? It's shameful, but that's how it is.
I think, too, a lot of it seems like in today's times in America and in probably other places in the world too, that a lot of times we just want the easy, quick fix. I mean, where everything is so rapid response. I mean, you can get almost anything you want at any time. And, it's not easy, like you said, cutting out weed or cutting out the bad foods that you're supposed to do, or exercising or drinking a gallon of water today. It's not always fun. But if you take the pill, popping a pill is easy, right? And, if like you said, if especially medical professionals or doctors are telling you it's going to work, and then, you have insurance and can help subsidize the cost, it's like, okay, we're running and gunning. We want a quick, easy fix. Hey, I can't do this right now. I don't want to make the salads. I don't want to make the grilled chicken. I want to pop into the drive-through and just grab something on the way to work. And I think that has a lot to do with it too, which I'm sure you agree, but.
Oh, absolutely. There are people who shouldn't even try this. They'll fail, or they'll get mad, or whatever. We can't change the world. But I tell you and your listeners and other people, in case you are interested, in case you're sick and tired of taking blood pressure medicines, a statin cholesterol drug, your mom developed dementia, age 72, you think you're at risk also. Your blood sugar is now high, and you got fatty liver. The doctor says, you got fatty liver, your AST, ALT are high, we'll do an MRI or an ultrasonic liver. Yeah, you got fatty liver. And you say, what do I do about it? Doctor says, there's nothing we can do about it. You can try to lose weight, but we'll watch you. And if you progress to cirrhosis, which is terrible, if you ever saw an alcoholic with cirrhosis, it is horrible. Ascites, fluid, throwing up bright red blood from varicose veins in the esophagus, esophageal varices. It is a horrible. So they say, we'll watch till you get cirrhosis. Then we'll put you on a liver transplant list, which is not a solution. It is a horrible, horrible procedure, and your life is abbreviated dramatically. So to say there's nothing we can do, what the doctor is saying is we have no drugs or procedures that I can profit from for your fatty liver. But the truth of it is you can get rid of fatty liver in 2 weeks. It's easy. It's really easy. I've done it many, many, many times. And the science is pretty clear. You don't want to hear all the details, but it's reversing insulin resistance, which is very easy, reversing what's called endotoxemia from a disrupted bowel flora, and not eating carbs that fuel a process called lipogenesis. It's easy. That's the kind of complex version, but the actual doing is actually quite easy. And you can have normal liver enzymes typically in 2 weeks.
Yeah, we, the wife and I, when we started our challenge, and we already try to make healthy options as it is, but we needed to lose weight, both of us. And, I before I started reading this, like I said, it's 75 days, and I read a couple of books before this one during this, but I already started, like if I, go get instead of getting like tacos or burritos, get the burrito bowl, and then maybe substitute the rice with like the cauliflower mash, and then, eat eggs and turkey bacon in the morning and ditch the whole wheat toast. Just kind of common sense that ditching out carbs would probably, help your waistline, but didn't know it was this bad. So I could say that probably after this, I don't think I'd ever be 100% wheat free. I'll be honest. I enjoy it every now and then, but I do think I will significantly cut it out. I mean, I've already been doing it and I feel great after this, and maybe use it as a special occasion, like if I want to go get a burger or a chicken sandwich or something. But no, I've really enjoyed the book and the talk, and I do think it's going to be life changing. And I hope people listen to this and follow you, because it's been really good. And like I said, just doing real basic stuff. I've known this forever, but a lot of what you talk about too, outside of, not eating wheat, is eating the right foods, which we know what we're supposed to do, but we don't. And it's a lot harder to do, but I know I'm not supposed to eat fried foods or drink pop or sweet tea and all that. So when I, eat greens and lean meats and all that, I feel a ton better. I've been on a roller coaster with my weight. I mean, I've never been like obese, but I've gotten probably up to 245, 250. And then right now I'm at about 215, which is pretty good for me. I think anywhere between 200 to 215 pounds for me is ideal. I mean, I graduated when I was high school, 185, super skinny. So I'm right about where I need to be. Just now I need to continue it, not go back down the weight gain that goes like this. And then, work on decreasing my body fat percentage, because it's still a little high. So
can we talk about the microbiome for a little bit?
Let's do it.
Because so people who go low carb,
mm-hmm.
whether they call it ketogenic or carnivorous or Atkins or whatever they want to call it,
keto,
which ketogenic diets. So what these people often do, not everybody, but many of them, what they do is they cut out the carbs, right? And then if they're ketogenic, you start to resort to burning fat. It's very good for losing weight, but you screw up your microbiome. So people are lulled by the initial upfront benefits. There's no question. You lose a lot of weight, your waist shrinks, your blood pressure drops, your triglycerides drop, sometimes fatty liver reverses, and people say, oh, I feel great. I can't believe it. I'm going to be ketogenic forever, or carnivorous or Atkins or whatever. What they don't recognize is that they've disrupted their bowel flora. One of the things, for instance, that happens, and we know this with good science, I'm not speculating here, is you lose microbes. So modern people have lost about half the microbes we're supposed to have already from antibiotics and drugs and other factors, glyphosate, herbicides, pesticides. We've lost a whole bunch of microbes. Then you go ketogenic or other super low carb, you kill off a whole bunch more bacteria. And once you kill a species off, it doesn't come back. But there's another thing that happens. There's a species called Akkermansia. And Akkermansia has the added ability to eat your mucus, your intestinal mucus. Its full name is Akkermansia muciniphila, mucus lover. So in a healthy person, you've got about 3 to 5% of your entire microbiome is made up of Akkermansia. You go ketogenic or other low carb, and a bunch of microbes die. Akkermansia goes way up, 10, 12, 15, 18, 24% of all your microbes. And it starts to eat you. It starts to eat your intestinal barriers. And that is very dangerous. It leads to diverticular disease, like abscesses, colon cancer, metabolic distortions. You regain the weight. Your triglycerides go back up. Your blood sugar goes back up. You start to have abdominal pain. You can get ulcerative colitis. In other words, a whole bunch of bad calcium oxalate, kidney stones, osteopenia, osteoporosis. So I tell you all that because too many people hear, oh, low carb, I can do that, not recognizing there's more to do, especially in the modern world where, when I get up in the morning, I don't go outside with my bone fragment, stone, or club and dig in the dirt for roots and tubers. That's what primitive people do. If you watch the Discoveries on one of those kind of shows and they're following one of these remaining hunter-gatherer populations, you'll see them. They're digging in the dirt every day to get underground roots and tubers and eat them or roast them over a fire. That's how they get their prebiotic fibers. And they're not as clean as we are, right? If you killed a wildebeest or a wild boar, you would open up its belly and eat the intestines and the stomach raw. And you got all kinds of microbes. And you lived outdoors. And so the modern microbiome has been, let me tell you one further story, because people love this part.
Yeah, absolutely.
So we've lost numerous microbes, tons. And some of those microbes are very important. One of the microbes we lost is Lactobacillus reuteri, Reuteri, named after the German discoverer, Gerhard Reuter. So 96% of them have lost this species. And this species was responsible for causing your brain to release the hormone oxytocin. Oxytocin is the hormone of love, connection, desire for human company, and reduced social anxiety. Now, put aside the pandemic, we now live in a time of record social isolation, record lack of empathy, record suicide, and sky-high divorce rates. Could the loss of reuteri and thereby oxytocin be responsible? I'm seeing this play out now because I got the microbe. You can get it. You can buy it. There's a specific product we use, and I make yogurt out of it. Not conventional yogurt. We use very specific methods of prolonged fermentation to get very high microbial counts. We consume the yogurt, and you say things like, I like my spouse better. I like my family better. I like my coworkers better. I introduce myself to people in line for coffee at Starbucks. I see other people's point of view better. And I'm losing my skin wrinkles. I have more dermocollagen. My skin is thicker. I got back a lot of strength and muscle I'd lost as I got older. My bone density improved. My appetite is turned off. Food tastes great. I have no impulse, no appetite whatsoever for garbage. I sleep deeper. I have deeper dreams. So, in other words, what we've stumbled on here is by restoring this lost microbe, we regain many aspects of youth and empathy and a desire for human connection. So anybody wants to do that, this is going to be in my new book called Super Gut. That's not coming out till February 2022.
Okay.
But if anybody wants to see that, there's a recipe called L-Reuteri yogurt. I think I call it a step-by-step guide. I show you by pictures how to make the yogurt because there's a few details here. It's not really yogurt. So people say, can I just go to the store and buy Faye or Chobani? No, that's something entirely different. This is the stuff we're doing. It looks like and tastes like yogurt, but it's not yogurt. It's a microbial count amplification system for specific species and strains that yields very specific effect. And that's what the Super Gut book is about, by the way. It's about addressing microbes. And so Justin, wives, kids can say things like, what microbe do I ferment to very high numbers if I want to recover quicker from strenuous exercise? What if a new mom, wants her baby to be healthier, sleep longer through the night, take longer naps, have 50% fewer bowel movements, 50% fewer diaper changes, less asthma, type 1 diabetes and autoimmune disease as an older kid? Ferment this microbe. So that we're now getting to the point where we can be very prescriptive. If you want this, do this. And that's what the Super Gut book's about. But in the meantime, there are a lot of conversations in my Wheat Belly blog.
So I'll absolutely buy the book when it comes out. But if I wanted to start implementing that stuff now, how could I do that right now? How could the average person get those microbiomes added right now?
So there's something people have to know about. It's kind of boring, so forgive me. It's called strain specificity.
Called what?
When you deal with it's called strain specificity.
Strain specificity. Okay.
So quick, my favorite example. You have E. coli in your gut, right? Your family has E. coli. I've got E. coli. So most of us have E. coli. But you ate lettuce contaminated by cow manure and E. coli, you can die. You've heard this on the news, right?
Sure.
E. coli, same species, different strain. So strain of bacteria can literally make life-death differences. So we have to pay. Unfortunately, a lot of commercial probiotics don't even tell you what the strain is, which is ridiculous. So we use 2 strains of Lactobacillus reuteri. We get it from a product that comes from Sweden called Gastrus, Gastrus. Those tablets are made for babies. And so they have very few microbes in them. There's 100 million of each. There's 2 strains in each tablet, 100 million each, which sounds like a lot. In money, it's a lot. In bacteria, it's almost nothing. So that's why I got this. I made yogurt out of it. Now, when you buy commercial yogurt, it's fermented for 4 hours. Bacteria don't have sex, right? You don't have mommy bacteria and daddy bacteria, and they have baby bacteria. They just double, unlike mammals and humans. So 1 bacteria becomes 2, 2 becomes 4. Reuteri doubles every 3 hours at 100 degrees Fahrenheit. So if you're fermenting commercial yogurt for 4 hours, you got almost nothing. We ferment for 36 hours. It allows the microbes to double 12 times, and it goes like that. And we counted how many microbes. Last count we had was 262 billion, so 1,000-fold more, and you get bigger effects. So we get the microbe, this product called Gastrus. We crush the tablets, 10 tablets. For greater bacterial numbers, I add something called a prebiotic fiber. It's very easy. Inulin powder you buy at the health food store, Bob's Red Mill, potato starch at the grocery store, $3, $4. A couple tablespoons of that. And then I think none of us cut fat, by the way. So if we eat pork, we eat the fat. You make bacon, save the grease, cook with it. Use more butter, use more olive oil. Don't cut fat. Cutting fat is a very destructive practice. So we use organic half and half, 18% fat. So put a little bit in, make a slurry, then top it up with the rest. Then you'll need some device to keep it at 100 degrees Fahrenheit, such as a sous vide device, slow meat cooker, or yogurt makers, or some of the Instant Pots. But if you use a yogurt maker or Instant Pot that has a preset temperature, you want to put some water in it and run it for a while, see what the temperature is. Because reuteri is very sensitive and will die if you exceed about 108, 109 degrees. So you want to keep it, you want some way of keeping this thing at 100 degrees Fahrenheit for 36 hours. And then first batch will be a little bit runny, second batch thick and rich. And we eat a half cup a day. And ladies are losing their wrinkles. I haven't been to the gym much during the pandemic, but pre-pandemic, when I ate the yogurt, people don't believe me, I gained 13 pounds of muscle in 3 weeks, and my strength went through the roof. I was handling weight I hadn't even touched since I was in my 20s. I'm 64. I was doing 200-pound, 10 reps, lat pull-downs. The leg press machine only went up to 415 pounds, so I just do a whole bunch of reps. Strength goes like that. So all these really cool effects. But that's a taste of what people can accomplish with purposeful restoration of their microbiomes. It's very cool stuff.
That process seems pretty intense for the average person. It would take a lifestyle change or an investment on all the things, but do you think there's ever going to be an easier way to do that? Or is it always going to be kind of a complex, time-consuming deal for, the investment of your health?
I'm working on it. We'll probably have some kind of product in future. Not as a yogurt. One of the things I learned was trying to make yogurt commercially is a major undertaking. And this is a premium product. It's not cheap to make. And you can't compete against $3.99, $4.99 quart products. You just can't. And so it'll be some kind of a supplement sort of product where people can take. Because right now, the microbe itself is available as a probiotic. It may be a different strain, one, or like with the Gastrus product, the counts are too low. And so there are people in Europe who are doing this, but they're taking like 50 tablets a day. That's dumb. So all the yogurt is a way to amplify bacterial counts. But we're going to have another way to amplify bacterial counts. So I can't say much more about it than that. But there will be ways, probably within a year.
That's awesome. Yeah, I'll never forget the first time I tried like non-fat Greek yogurt as opposed to like the, loaded sugary stuff like Yoplait or all that, like the strawberry banana yogurt. When I had yogurt, it was, non-fat Greek, no sugar, how mind blown I was and how terrible it tasted to me. And then the same with like peanut butter. You eat Jiffy all your life or the Peter Pan kind. And then I made my own peanut butter at like a Whole Foods. And I was like, oh my God, this is terrible. It's like, what happened? It just kind of speaks volumes about our food culture and the things we eat that we don't really know about. I mean, I don't think I had like real peanut butter until I was like 21 or 22. So I was thrown for a huge curveball. And, that's not to speak to anybody like, parents took good care of me, but I mean, growing up, I mean, you eat that stuff in school and it's all around you. It's hard to find the rare good stuff at the grocery store or Walmart as it is. So, and then when you get it, you're like, God, this is terrible. So
one of the things you and your listeners should be aware of is when you go wheat and grain free, not only does your GI tract heal, your taste perception changes. And you're going to find foods you previously thought weren't so tasty, like natural peanut butter or 90% cocoa chocolate or Brussels sprouts. You may say, you know what, I love them now. And you'll find if you try to have, say, a piece of milk chocolate, you'll spit it out. So it's so disgusting because it doesn't taste like you thought it did, and it's far too sweet. So your taste perception is going to change also. And you're going to find people say, I love asparagus. I love, and so we don't limit fat. Of course, eat no grains. And the whole experience of hunger also changes. Hunger for most of us is not this gnawing kind of a desperate feeling. It's this mild restlessness that occurs typically 7 to 8 hours after you last ate. So hunger, meal habits, all go out the window. It's all very different on this lifestyle.
Do you encourage fasting of any sort, whether that be like a 24-hour, a 72-hour, or I know some people do like 3 or 4 days once or twice a year. And then, of course, there's intermittent fasting. Just on a whole health concept, do you ever encourage those, or is that something you're not really into?
Yeah, I do, but I don't think it has the benefits that many people believe it does in this context, in this lifestyle. So if you're eating an American diet, you're going fast food once in a while and frying your food and cutting then I think there's benefits to fasting, genuine benefits. But if you're doing what we're doing, which is eating no wheat, grains, or sugars, addressing the common nutrient deficiencies that modern people have, like magnesium, because we drink filtered water, and then addressing microbiome, the benefits of fasting are small and incremental. So you don't get the big benefits because we've already corrected. In other words, if we were to track markers like triglycerides, fasting glucose, fasting insulin, small LDL, NMR, lipoprotein, all that stuff we can track. You'll see the fasting doesn't really do that much. Now, this whole notion of autophagy is a mouse conversation. There's virtually no human data. So maybe it happens, maybe it doesn't. So.
Well, Dr. Davis, we've talked a lot about my questions and topics that I had, and I wanted to ask you a question and then give you a little time to talk about what you're up to currently. So with that being said, you started as a cardiologist and then you kind of had this awakening, right? And started doing things a little differently and kind of going out on your own and writing books and going on TV shows and becoming a New York Times bestseller. And now you're writing multiple books, you're coming out with, food products and microbiomes, and now you're a new podcaster. What is life like for you nowadays on a daily basis? And tell people listening, what you're doing currently besides the things we've already discussed.
Well, writing the book was a lot of work, but I got it done. My publisher has it now. These fermentation projects that we were talking about, like with Rotary and others. So we have a website called the Undoctored Inner Circle, which is a smaller community, but it's very deeply involved people. And you'd be shocked, Justin, what people are experiencing there. People are getting rid of obsessive behaviors, compulsive behaviors. Diabetics become non-diabetic. People are losing, extraordinary amounts of weight. And we collaborate. It's like this. I did this last night with 70 people. And we're talking about, well, what happened with your bifidobacterium infantis yogurt? What happens with bifidobacterium? So one guy, for instance, he was twirling his hair ever since he was a kid. He took, of course, a bunch of antibiotics, and he developed a compulsion of pulling his hair out. There's a name for it, trichomania or something like that.
Mm-hmm.
And he's now in his 40s. He ate yogurt made with bifidobacterium. I'm sorry, he took a probiotic, bifidobacterium longum. And within several days, the compulsion stopped. Now, that's not proof, but we're learning all sorts of new lessons. So that takes a lot of time also. We started a new company in Illinois. I'm in Milwaukee, Wisconsin. We started a new company in Lake Bluff, Illinois, that is going to produce some of these products, but also fund the research. One of the problems in nutrition is there's a lack of research. We really need to do the research. And so we're doing a very intensive research program. We have 5 clinical trials that I've designed. We're going to be performing, including some animal studies, to look at such things as reuteri and understand it better, as well as what's called the endocannabinoid system. It's not cannabis. It sounds like, but it's not. And we're exploring that also for some very, very unique and powerful effects. So, so very busy stuff.
Do you got anything else you want to cover? We covered quite a bit. I know we had some topics we talked about before, but we've had some good talks and good times. And anything else you wanted to touch on before we cut out?
See the crazy color? Yeah.
Oh yeah, it comes and goes.
Yeah, isn't that weird?
I'm colorblind too, so it kind of blends into me. So
I think we covered it, Justin. I may have overloaded you in your audience, but,
no.
But there's a ton of great stuff going on. There's a ton. The crazy thing is, if you go to the doctor, hey doc, tell me about oxytocin and reuteri and gliadin-derived opioid peptides and how I can reduce my hemoglobin A1C without drugs. You've been consulting Dr. Google again? They are not in the business of health. And Justin, how can we allow this? It is David versus Goliath for all of us, but we've got to do this. If big media says someone like Justin is not welcome here because he speaks his mind and his opinions are not in the interest of our advertisers. That is what media has become. So we've got to do things like this.
Sure. Yeah, I've enjoyed it. I love it. And speaking on like medicines, I mean, I don't have a lot of issues, and mainly medicine I would take would be like a multivitamin. And I used to take allergy medicine. I still do off and on, but my allergies don't seem as bad when I clean up my diet, which probably makes a lot of sense. But I've never had major issues, but I've also never been huge on taking medicine unless I really need it. I try to really avoid it. That's just something I've always kind of been about. I'm not scared of pills or anything. I feel like whether it be low level aspirin or Tylenol or anything super high, people get this dependency. Like you see people that, they take ibuprofen like daily for different things. I never wanted
drugs
that.
Like that, drugs like that, Justin, that were billed as benign are not. They are absolutely not benign. Like a good example are the stomach acid blocking drugs, ranitidine, Prilosec, Protonix, Acifex. Those things are very destructive. They change your microbiome. They allow microbes to ascend from stool and go up into your ileum, jejunum, duodenum, and stomach. And that cascades into skin rashes, acceleration of dementia, pushes you closer to type 2 diabetes, coronary disease, atrial fibrillation, fatty liver, on and on and on. So from stomach acid blocking drugs, the non-steroidal agents you're talking about, like ibuprofen, diclofenac, and naproxen, are very destructive. I lost count how many people I put on dialysis because of those damn drugs, kidney failure. But they also cause intestinal ulcers, not just stomach ulcers, but intestinal ulcers also. And they also invite stool microbes to ascend into the upper bowel, which is a big, big problem. So drugs, over the counter, yeah, right, safe. No, they're not safe. These drugs are not safe. There's an emerging conversation. It's epidemiologic, so it's not entirely solid, but the association was powerful. That, vaccines have been blamed for autism. But I think a more logical argument is that kids get vaccines, have a little bit of a febrile reaction, get acetaminophen. And that science is unfolding. It's not the vaccine, it's the acetaminophen. And everyone thinks Tylenol is benign, right? So you're absolutely right. These drugs passed off as benign are not benign. And by the way, they're never studied for microbiome implications because the FDA does not require it. They may in future, but not. So right now, you can take multiple drugs. Statin drugs disrupt your microbiome. Non-steroidal drugs do. Stomach acid blocking drugs do. They all change your microbiome. And it's that those phenomena are responsible for a huge amount of disease. But you ask your doctor, he won't know a goddamn thing about it.
Sure. It's unfortunate, but I believe it. It's been great chatting with you. I really appreciate it. My final question to you is a personal one. And I try to ask everyone this and I forget all the time, but I do ask often. Give me 2 songs that are on your playlist currently.
You might not like my taste.
Oh, it's fine.
One of my favorite vocalists is Carly Clément. Carly Clément. She's a French vocalist.
Okay.
She doesn't sing in English. She sings only in French. And Lorna Lee, also a French pop singer.
Okay. Do you speak French?
Haltingly. Took it for a few years as an adult.
Very nice.
A little bit of German, a little bit of Italian, a little bit of Spanish.
Well, if you listen to any of my episodes or see any of my guests, they're a very, very diverse group of people. So it's always fun asking that. And like I said, I don't always remember because we, dive in conversation, but it's very interesting. And then what I try and do is I try and add those songs onto a separate playlist and listen. And that's kind of how I go anyways. I listen to a ton of different genres, but, so now if I add these on there, this French singer that I've probably never heard of in my life. And then, the last guy listens to like AC/DC, and then the guy before that is into rap. So it just kind of brings back cool memories, and it's kind of nice to see. And
it's a cool question.
Yeah, it always throws people for a curveball too, because I say I'm asking something personal, and they're like, "What is it?" It's like, "Oh, music, okay." So
another good one, if you get into French music, is Stéphane Pomponiec.
Okay, I may have to have you email me that so I can, spell it right. But that's good stuff, man. Dr. Davis, I've really appreciated your time. It's been insightful, and hopefully we'll get some good listens out of it, and people will kind of gain some knowledge. I feel like, people need it. I know I need it. I mean, I've, like I said, never been morbidly obese, but I've definitely been fat, feeling great and kind of on a health kick. And I really, really want to be a little more steady instead of, I lost weight and then I go up and down and I go up and down. Yep. So I really want to, continue this snowball effect. So
I hear you, Justin.
Just just go ahead and tell people where they can find you. Tell them about your Defiant Health podcast, where to follow you on social media, maybe your website, and then we'll wrap it up.
Okay. So anyone wants to hear more or learn more about these kinds of ideas, my Wheat Belly blog is the place to go. It's got over about 2,000 articles. Also the books, thank you. So there's a Wheat Belly revised expanded edition that came out in 2019 that has all the basic ideas laid out and the rationale and the scientific references also. Real serious Undoctored book and the Undoctored Inner Circle, which is a membership website. My new book is coming out in February 2022 called Super Gut, and it talks about all these problems we have with the microbiome, but it's prescriptive. I'm always surprised at the books on the microbiome on the market say things like, take a probiotic and get fiber. Well, there's a ton more things you can do with magnificent results. That's what I'm trying to do here. And then to lead up to that, I started, as you point out, a new podcast called Defiant Health. And it's about these kinds of ideas. But conveying to people that you have spectacular power over your own health. Just don't ask the doctor.
Just you, right? You're the doctor to go to. None of the other ones.
And there are other people who say similar things.
Sure. Far and few between them.
Yeah, and none of us get on TV, Justin.
Yeah, I watched some of your old stuff, but as you said, none of it was recent. So maybe that'll change one day, hopefully. But once again, Dr. Davis, thank you. I appreciate the insight, appreciate the knowledge, and look forward to following you and then getting some of your new books coming out. So we'll talk to you soon.
Send me the link and we'll share it with everybody.
Yeah, absolutely.
All right. Take care.
All right. Bye.